I'm going to tell you a little bit about how community education provider networks are being developed in South London, and then again, as Sean said, you're going to hear about the slight differences in each of the other two sectors. Essentially, overall, this is about bringing education and service together to the betterment of each. Because historically, as we identified this morning, on that lovely scatter diagram that our Bromley colleague presented to us, primary and community care works in a very dispersed environment. We're all over the place in many different sites, not within the four walls of a hospital. And we think probably that both the education and the service could be better than it is, and we can use each of them to make the other half of it work better. That's the, if you like, that's the overarching theory behind all of this. Sean, are you going to be the... Okay, so there you see South London in all its glory. Those are the districts of South London. We've made the decision to create our CEPNs, as they're known, on more or less the geographical basis of boroughs. So sort of the old PCT boundaries. So it's bringing together the people in primary and community care who do both the care of the patient and the training of the people who care for the patient within those geographical boundaries. And the next one. And this is the notion of the network in itself. What does the network involve? It involves those things. Now, the network may be piggybacked on existing networks, for example, federations of GPs. That's just one of the building blocks, if you like, but it could be based on other pre-existing networks in a particular borough boundary. But you can see the providers, both of education and service, that are part of the network as it's displayed there. It's a defined geography, as I've said. It's about workforce development targeted towards the needs of that particular population. And like I just said also, it's a networked arrangement of those particular individuals. So if we go on. This is the last slide. There's a lot on it, I'm afraid. But our vision, if you like, of what the CEPN will do ultimately, and we recognize that it's going to take 2 or 3 years minimum for this to come about. It takes a long time to engender change and to develop the appropriate networks that can provide it. So they're going to have a role in workforce planning. What is the particular mix of clinicians that we need in each borough to provide to the healthcare needs of that population? And it's going to vary clearly between boroughs. It's about delivering education quality. So the people who do the service arguably are the best people to do the education as well. Those are very broad statements, I acknowledge that. And perhaps we can talk about the detail later if you're interested. It's about developing essentially a faculty of all those healthcare professionals and teachers in order to deliver both those functions. It's about a bit of workforce planning and responding to the workforce needs. So, for example, CPD. What do our district nurses, our GPs, and everybody else who works in the community and primary care need both for their CPD and for the generation of new members of those professions? And so naturally that opens up the whole area of the coordination of educational programs, both for pre-cert and after that. And in order to do that, we need to make the appropriate links with CCGs, with social care agencies, and whoever else is on the patch.
I'm Paula McLaren. I'm the lead nurse for Barnet's CEPN, as we call ourselves. I'm also a practice nurse practitioner in Barnet as well. I'm going to talk to you about one aspect of our CEPNs, which is what I was led to believe I was going to talk about, which is our student nurse placements, and something that we're all struggling with, not only across London, but across the whole of the UK with an ageing practice nurse population. So, you know, our model within North London is pretty much along the lines of what John has just been saying in terms of community education provider networks, supporting service delivery, developing workforce. So I'm not going to say all that again. Okay. I've got a few more slides than John had, but a couple of them got pretty pictures, so I'll try and be quick. The questions that I tried to think about what people wanted to know in terms of student nurse placements within general practice. Within general practices, it has been a real challenge in terms of engaging practices to make them want to take on student nurses. What's in it for them? And I just want to really talk about the next steps and kind of how we're moving on from where we are now. We've been placing student nurses in Barnet. You can move on, actually, I'm talking. Alongside each CEPN was given a university to work with for the purposes of student nurse placements. It's slightly different for CPD in that we can pick and choose what we need from across the whole of London. So we were given the University of Hertfordshire, which was really fortunate for us because I used to work there. So I've written there, if there's one thing that I can stress, it's about relationships. It's all about relationships. It's all about the relationships that I had with the university. It's about the relationships that I had with the local trainers and with the local practices. And some of that has come about because of the work that I do with our clinical network as well, which is about service delivery. Sorry, did I cover everything on that one? Go back, sorry. Fire at them from all angles in terms of engaging everyone. Get yourself out there, get talking to everyone. We initially did some sexy advertising for students. So in order to get students in, what we did was we chose to ask students if they wanted an exciting elective placement. So the first round of students that we had were all students who actually really had an interest in primary care and practice nursing. So that was a bonus for us. And the other thing that I did to make my life easier was that I only chose placements in training practices because they were already established educational providers. They have GP registrars, and I sold it to the trainers. I went to the trainers' workshop and I talked at them for a long time, over and over again, saying that it wasn't beyond the realms of possibility that they could support a student nurse within their practices. And I was successful for a bit of the time. So the challenges were the nurses themselves. There's a lot of apathy out there. A lot of nurses are saying to us that there's no time to see patients, let alone support students. The practice managers as well, they were interested in money. How much will we get to have a student nurse in our practice? So it was about kind of, and the one thing that they did was we tried to sell it. I tried to be really positive and say it was half a trainer's grant, which sounds like an awful lot of money for a GP trainer, correct? So, but then they all broke it down into, it was about, I think it's about £17 a day or something. It was really, they all break it down into minute amounts of money. So that was one of the challenges that we had to get across. But the thing that I kept saying to them was it isn't about money, it's about the sustainability of our future workforce. So I kept going back to that. I kept kind of veering away from the money because the money was set in stone. I didn't really have any influence on that. The GPs were a challenge as well. Lots of GPs told me they were losing money to have a student nurse placement. So again, I said to them, well, in 5 years' time, when you don't have any practice nurses, don't come to me and ask me why. So, you know, I was as blunt as that with a lot of them. There is a tariff. I've mentioned the tariff briefly. It's half a trainer's grant. So for practices that have a student nurse on an ongoing basis, they will receive some financial incentive. The CEPN has never provided funding really for backfill, and that was one of the issues as well, was that if we're going to release our practice nurses to support student nurses, you know, who's going to see the patients? And again, it's selling the whole concept to them again, showing them the bigger picture, and I hoped that by engaging training practices, they were able to see the bigger picture. So we tried to make it as easy as possible. We developed timetables so that the nurses didn't have to develop their timetables. I really encouraged the use of the whole team, so the student nurse didn't have to be with the nurse mentor the whole time. She could be with the GP, she could go to the diabetes specialist nurse at the local hospital, she could go out with the district nurse, she could work alongside the healthcare assistant, and she could even see her own patients. So that was a bit of a selling point, in that they could see that there was some benefit in getting patients seen. I was going to say something else that's gone now. And I think you need to get out there, and you need to meet the practice nurses, the practice managers and the GPs, keep on talking to them, keep on trying to engage them. One of the things that worked really well for us was that after the first round of students was that people started talking about it, and there was this kind of feeling against all the negativity that actually having a student nurse in the practice was a real breath of fresh air for the patients, for the practice and for the staff. So that was a real positive for us. So we've now got practices coming to us wanting to take on student nurses, which has been good. Keep in touch, send them emails all the time. That's part of what we did. Again, I come back to relationships. It really, really is about relationships, networking, and making those relationships work for you. We need practices to engage with this project. We all know that we risk a future without an experienced primary care team. GPs alone cannot support the needs of the local populations. We need practice nurses. It's a huge opportunity. So part of the thing about relationships is engaging enthusiastic people, get them on board, and they were talking about that this morning. So kind of getting those few followers enthusiastic and get them doing your dance along with you. Yeah, this is from a previous slide I did to some of the GP trainers as well. So I warned them that I'd be coming to their trainers workshop to be nagging at them. And I think I've just got a couple of pictures. So this is a future. I want you to put yourself, looks like John, I think, a little. So put yourself in the position, sorry John, of a patient now. Who would you rather do your child or your baby's immunisations? This man or this nurse? So.
That's me. Hello, I'm Vicky Suster. I work in Tower Hamlets. Some of you know me. Could I just have a quick show of hands and find out how many people from primary care, from GP practice settings here in the room? Anybody from community nursing side? Lovely. Okay, well this is about some of the initiatives that we've been doing that we hope to move out from the old traditional boundaries of practice nurses and practice training and GPs having lots and lots of educational support. My slide's a little bit about how the CEPN, how the Community Education Provider Network, has helped us to think a little differently. Although my first slide, which says what I'm going to talk about, does have something that we were doing before the CEPNs existed. So the practice nurse recruitment and training, if you could just bring the next slide up. What we've been doing for quite a long time in Tower Hamlets is helping people to transfer from acute nursing or other backgrounds into practice nurse jobs. So this is the other sort of side of the coin from what Paula's been talking about, where you've got people who are keen to come in, and we'd love to have more undergraduates come in and do that too in our area. But when they're qualified, we want them to come back, and the best of them to become practice nurses. So really, this project is now very supported by the CEPN network that I'm in. There's no formal training that's been nationally recognised at present for practice nurses. We created this about 7 years ago. We started working on creating a practice nurse training that actually our real vision was that one day it would become a national standard. And we've come quite a long way with that actually, because it's now funded by HENCEL in our area, which is fantastic. So we're really pleased that it's now funded by HENCEL. It's a 2-year course. Talk about having to be in leadership and hear lots of people saying no. As we heard this morning, you know, often when people want to do new things, either they're crazy or they're bad, you know, bad, mad, or something else. And I think at various times people thought I was both crazy and very bad. But you know, at the end of the day, you've got to keep the patients at the centre. And what we wanted was for really well-qualified, well-trained staff to be dealing with practice patients wherever they are. So we created this 2-year programme with City University London, and we've got a very special team. The reason it works is because of my team. It's not about me at all. I have 4 fantastic advanced nurse practitioners who, and I've had different ones in the past. One of them in the room, Catherine, used to be one of those fantastic people who for a time was a clinical mentor on my team. And what they are is they're really senior advanced nurse practitioners who've got years and years and years of experience in general practice and are now using that experience to bring young people and not always very young, but new people into the service. So that team of 4 people is still existing. When I invented them, everybody said it would never work, but it does work, and we now can prove it. So that's been a good experience. The next slide, please. This is something completely different. When I took on the practice nurse training research, they asked me to look at healthcare assistant training. We had lots of healthcare assistants in Tower Hamlets who were already in post. We didn't need to recruit more in. The practice nurse one is a recruitment tool. You know, so we began to think about how we could help HCAs to be trained. So we set up some very good quality healthcare assistant training for general practice, which involved working with the Open University, and they all went on to a training programme where they got an MVQ level 3, it's now a diploma level 3, in health and social care, alongside my team providing the clinical training. So they got clinical training from clinical nurses who work in the patch, and they get Open University support for an academic qualification. So, and the exciting thing is that the Community Education Provider Network has now kind of encouraged us to think outside the box. So we've been in discussion with pharmacy leaders to think about joint training with medicines counter assistants. Those are the people that serve you when you go to the chemist to buy your shampoo or get your medicines. And it's actually been really exciting to do this pilot. We have 7 HCAs from practice, 3 from local pharmacies, and we're building amazing links. As Paula said, the relationships are the most important thing. But they need the same skills as healthcare assistants in practice. You know, they're advising people about their diabetes, about their asthma, about how to take the medicines, you know, how to take their asthma inhalers. So we found a common ground in which we've developed the programme for that. And I think clinical lecture programme, what does that say? Oh yes, clinical lecture programme plus visits. We do, our team go and visit people. It's not about just standing there lecturing at people. Our team goes out and visits people. So each person gets 3 visits, and they're assessed in practice for things like doing a foot check for diabetics, doing a new patient check. It's been a bit of a challenge thinking about the medicines counter assistants, how we assess them. So we're just doing exploratory visits to them at the moment. So the last slide is about another project that we've started, which we would never have done if it hadn't been for the Community Education Provider Network being set up, because it was the one thing I thought about when we decided to do CEPNs. I went to the CCG and I said, look, this is the sort of thing we could do if you let us become a CEPN, you know, if you encourage the CEPN in this area. And in fact, it's come into being, which I was quite surprised about. We actually ended up doing it through some money from HENCEL, Health Education England, North Central East London, which is called locality funding. So this is about crossing the boundaries properly now, and I think this is really exciting. So basically, we've got some residential care home staff looking after increasingly unwell residents as they get older with complex healthcare needs. So we've designed some bite-sized teaching to just address 4 key areas, and it is tiny. It's 2.5 hours for each session, and we're repeating it twice and delivering it in the care home and giving them a lovely lunch. So, you know, we're really trying to work to support them because they feel very unsupported, many of the staff. They're at about level 2, band 2 staff. They're not trained in any clinical area at all. So this is very gentle, supportive, looking at how they can help residents to become independent within their chronic disease, and also helping to skill them up so that they know how to troubleshoot when things start going wrong. So the first session looks at CHD and diabetes, and that's just for 2.5 hours. The second session looks at asthma, COPD, and skin care and wound care. And they're interactive sessions. We're getting about 12 to 15 people each session. We've just finished the pilot in the first, well, the pilot finishes in the first care home tomorrow, and the staff feedback was fantastic. Again, it's not me doing this teaching, it's my fantastic team doing the teaching, and the feedback was we've never had teaching like this. This is the best training we've ever had. It was practical, it was gentle, it was supportive, and it was really good, and it's being very well received. So if you want to ask any questions about any of that, please ask them later, that'd be good.
The way we've done it differently is because rather than a geographical base for our CEPNs, by the way, we all call them something slightly different. There's CEPNs, CEPNs and CEPNs, very interesting. And we've somehow got to get that all together into one hub over the next few months. I don't know how we're going to solve that one, but our big difference is that we're not based geographically, we're based on pathways. And so all of our projects, though they are based in one borough or two boroughs or three boroughs, they are about pathways, and I'll introduce you to the pathways. The big advantage of this is that we've been able to tap into a huge amount of energy for innovation, because we invited people to apply, and we didn't say enthusiasts only, but it was really, that was in the subtext. And so we've got some fantastically energetic and energizing projects, and our task over the next year is going to see how sustainable we can make them and spread them through the patch and across into other parts of town. So apart from that, you'll recognise there's lots in common, bringing service and education together, crossing boundaries in new and innovative ways, solving problems that other people or projects can't reach. There's a lot of that completely in common with what you're doing. And it's interesting, we've all approached this from a different angle, and we've all come up with slightly different solutions. I'm sure we all think we're all the best, but it's very interesting to hear what you're saying, and I'll perhaps expand on that a bit later, thinking about practice nursing. Right, so we're bringing together health and social care providers, community groups, education, focused around enabling the development of learning communities. And that's the sine qua non. Are you providing value for money? Of course. Are you developing a learning community? Can you make it sustainable? And those are the sort of three questions underlying. And they focus on completely different parts of the health and social care workforce, including patients and public, and every project has got a different mix. Right, this is far too busy, this slide, but the model promotes facilitating integrated care, educational projects across the whole workforce, acting as a catalyst for the adoption of best practice, again across groups and services, and creating new innovative educational models to support workforce transformation, engaging patients and the public in the training and education of healthcare workforce. And all of our CEPNs have some kind of mix of those in them. And I think what I should do now is just flip on to, I'll give you a quick run through. I'll concentrate on the ones that are involved nursing. A line is about falls, and it's run by allied health professionals, physios, OTs, paediatrists, dietitians, and some speech and language therapists. They're based in one borough, but they're spreading their tentacles out to 3 or 4 more. And of course, community nurses in particular will have a lot of patients who are at risk of falls. And I must confess that I was coming here and I realised I hadn't checked to see how many nurses were involved in this project, but it's the sort of thing where nurses can very easily get involved. And thinking about next stages, moving on from AHPs, that would probably be what we'll be looking for and looking at. This is a fairly recent one. There's lots of stuff coming up. Next one. Brenton Harrow. Right. This is based in care homes where most of the staff are healthcare assistants, and it's probably the managers and even owners who are nurses. But right across all of those, including the GPs, the ambulance service, and the voluntary sector and social care, have come together to run educational groups. These are based on, any GPs will recognise the Barlink group model, and increasingly psychiatrists in training, but it's to give a reflective space to caring staff to talk about not only what they do, but some of their feelings around it and how they can improve the care they deliver. And it's had fantastic support, and they've built in sustainability by training up people to carry on running these groups after the funding runs out. And from a ground up project, I think this is one of the most fantastic that we're doing. Next. Connecting care, I'm not going to spend time on it. It's mainly about doctors. Fabulous senior trainees in paediatrics going out to work with more junior GP trainees in practices doing outreach clinics, champions, children's champions, all the rest of it. Now, the end of life care CEPN is about blended learning for qualified nursing and unqualified staff from different providers coming together, doing e-learning and then learning groups together on end of life. And that's based at Chell West, but it's spreading right through 3 boroughs. Again, a little bit of a mix that I was referring to earlier. Next. This is based in Hounslow, and it's not only led by an obstetrician and a GP, but most important, 2 sets of nurses, midwives and mental health nurses, who are addressing proactively and preventatively, trying to prevent mental health problems and certainly crises before and after childbirth. And again, it's quite new. They've developed a huge amount of community-based activity, educational stuff, as well as working with staff in different organisations and institutions. Pressure ulcers need no introduction. This is a fantastic project that, of course, is very much based in central London healthcare nursing, and their major partners are patients and their carers. And it's not only about providing pressure ulcer care, it's also about preventing and knowing the warning signs for carers of patients who are at risk. And they've developed an app, and it's called PU Info, and you can get it from the Google Store or the App Store, and it's really aimed at people spotting what ulcers are like and what they can look like, but how to catch them in their early stages. So that's a hugely useful project that has nursing very much at the heart of it. I think, oh yes, quality improvement. I'm not going to spend much time on that. There's these things called sprints where you get a whole bunch of separate people together, people who've got no idea about healthcare, artists and so on, who always ask the best questions, getting together in an intensive two-day sprint to drive prototype and then drive innovation in healthcare. I went to one last week. It was all about London Ambulance Service. They've popped up again. London Ambulance Service trying to work more closely with rapid response teams, of which there are 6 in northwest London, all with different referral criteria, jolly difficult to work with, and hopefully keeping people out of emergency departments and aiming them back towards rapid response teams and their practices. I think that's it. What I want to say, and I hope will come out in questions, is that for all the differences, I think it's really important that we bring out some of the similarities too, and some of the excitement around working multi-professionally and working across boundaries in all sorts of ways, geographical boundaries, but also institutional and professional boundaries. And some of the problems that throws up, but people are really determined to do something about it because they've got patients at the heart. I rest my case.